Connective tissue is broadly classified into two main categories based on its maturity and composition. These two categories are connective tissue proper, which itself includes loose and dense connective tissues, and specialized connective tissue, which includes cartilage, bone, and blood or lymph. Let us begin with connective tissue proper, and specifically with loose connective tissue. Loose connective tissue is characterized by having loosely arranged fibers, an abundant ground substance that fills the spaces between cells and fibers, and numerous cells of various types that carry out specialized functions. Its primary functions are to serve as a packing material around and between structures, to provide cushioning and support for organs and tissues, and to act as a primary site for inflammatory responses when the body is challenged by injury, infection, or other pathological processes. There are several distinct types of loose connective tissue, each with unique structural features and functions. Areolar tissue is the most widespread type and is found throughout the body in virtually every region. It contains all three fiber types, including collagen fibers, which provide tensile strength and resistance to stretching forces, elastic fibers, which provide recoil and flexibility, allowing tissues to return to their original shape after deformation, and reticular fibers, which form a delicate supporting network for cells and small structures. It also contains multiple cell types such as fibroblasts, macrophages, mast cells, and lymphocytes. Areolar tissue is found under epithelial layers surrounding organs such as the heart, lungs, and digestive tract, and around capillaries. Adipose tissue is another form of loose connective tissue, and it comes in two distinct forms with very different functions. White or unilocular adipose tissue contains mature adipocytes that each contain a single large lipid droplet that occupies most of the cell volume, pushing the nucleus and cytoplasm to the periphery. This tissue functions primarily in energy storage as triglycerides, which can be mobilized during periods of caloric deficit, in thermal insulation to conserve body heat and maintain core temperature, and in mechanical cushioning to protect vital organs such as the kidneys, eyeballs, and joints from impact and compression. Brown or multilocular adipose tissue contains adipocytes with many small lipid droplets distributed throughout the cytoplasm and numerous mitochondria that give the tissue its characteristic brown color. Its primary function is heat generation through a process called non-shivering thermogenesis, which is mediated by uncoupling protein 1 in the inner mitochondrial membrane that allows the dissipation of energy as heat rather than adenosine triphosphate production. This is especially important in infants who have a higher surface area to volume ratio and are more susceptible to hypothermia. And in adults, it is found in specific depots, such as around the neck, in the supraclavicular region, and along the great vessels. Reticular tissue is a specialized loose connective tissue that consists of a delicate three-dimensional network of reticular fibers, which are composed of type 3 collagen, and specialized reticular cells that are modified fibroblasts. This tissue forms the internal structural framework, also known as the stroma, of hematopoietic and lymphoid organs, such as lymph nodes, where it provides support for B and T lymphocytes, the spleen, where it creates compartments for red and white pulp, and bone marrow, where it supports hematopoietic stem cells and developing blood cells, as well as the liver, where it forms a scaffolding for hepatocytes and sinusoidal endothelial cells. Dense connective tissue is also part of connective tissue proper, but differs significantly from loose connective tissue in its organization and mechanical properties. Dense connective tissue is characterized by being dominated by thick, densely packed collagen fibers, with fewer cells present compared to loose connective tissue. And the predominant cell type is the fibroblast, which is responsible for producing and maintaining the extensive extracellular matrix. This tissue provides high tensile strength and significant resistance to stretching and tearing forces. Based on the orientation and organization of the collagen fibers, dense connective tissue is further classified into three main types with distinct structural arrangements and functional properties. Dense regular connective tissue has collagen fibers arranged in parallel bundles, aligned precisely with the direction of stress placed on the tissue during normal physiological activities. This parallel arrangement provides great strength in one specific direction while allowing for some flexibility, making it ideal for structures that experience unidirectional tensile forces repeatedly. Classic examples include tendons, which connect muscle to bone, and must withstand the powerful pulling forces generated by muscle contractions during movement, and ligaments, which connect bone to bone and help stabilize joints while allowing for controlled range of motion, and aponeuroses, which are sheet-like tendinous expansions that attach flat muscles to bone or to the fascia of other muscles, distributing forces over a broader area. Dense, irregular connective tissue has collagen fibers arranged in an irregular, mesh-like pattern with bundles of fibers running in multiple different directions, interweaving with each other to form a thick, felt-like network. This organization provides substantial strength in multiple directions, making it ideal for structures that must withstand stresses and tensile forces from various angles. Examples include the dermis of the skin, which must resist tearing and shearing forces from many directions during movement, stretching, and external trauma, and the fibrous capsules that surround and protect organs such as the liver, kidneys, spleen, and testes, as well as the capsules that enclose diarthroidal joints such as the knee, shoulder, and hip, providing structural integrity and containing the synovial fluid. Dense, elastic connective tissue contains a high proportion of elastic fibers interspersed among the collagen fibers, creating a tissue that can stretch significantly and then recoil back to its original shape after the stretching force is removed. Examples include the walls of large elastic arteries, such as the aorta and its major branches, which must expand to accommodate the surge of blood during ventricular systole and then recoil to maintain diastolic pressure and continuous forward flow. The vocal ligaments, which must vibrate and return to position during speech, and the ligamentum flavum of the vertebral column, which helps maintain upright posture and allows the spine to return to its neutral position after bending. Now, let us discuss specialized connective tissue, beginning with cartilage. Cartilage is a firm, resilient, and flexible connective tissue that has a unique extracellular matrix and contains no blood vessels or nerves, meaning it is completely avascular and receives all nutrients and eliminates all waste products by diffusion from surrounding tissues through the perichondrium or synovial fluid. The cells of cartilage are called chondrocytes, and they reside in small spaces within the matrix called lacunae, often arranged in groups of 2 to 4 cells that represent clones derived from a single progenitor. The matrix itself contains collagen fibers and, in some types, elastic fibers, all embedded in a highly hydrated gel-like ground substance rich in proteoglycans, particularly chondroitin sulfate and keratin sulfate, which are attached to a core protein of aggrecan and bound to hyaluronic acid, creating enormous aggregates that trap water and give cartilage its unique ability to resist compression while maintaining flexibility. There are 3 main types of cartilage, each with distinct matrix composition and functional properties. Hyaline cartilage is the most common type and appears glassy or hyaline when viewed under the microscope due to the fine, barely visible type 2 collagen fibers in its matrix. It functions in providing smooth, low-friction surfaces for articulation, in supporting soft tissues with some flexibility, and in serving as a template for endochondral bone formation during development and growth. Examples include the articular cartilage that covers the ends of bones at synovial joints, the costal cartilages that connect the ribs to the sternum, the cartilage that forms the shape of the nasal passages, and the C-shaped rings that form the trachea and bronchi, keeping these airways patent during respiration. Elastic cartilage contains abundant elastic fibers within its matrix in addition to type 2 collagen, which gives it exceptional flexibility and elasticity while maintaining its characteristic shape and resilience. Examples include the cartilage of the external ear, also called the pinna, or auricle, which must be flexible enough to bend without breaking yet elastic enough to return to its original shape. The epiglottis, which closes off the laryngeal inlet during swallowing to prevent aspiration of food and liquid into the trachea. And the auditory tube, which connects the nasopharynx to the middle ear and must remain patent yet flexible to allow for pressure equalization. Fibrocartilage contains thick, densely packed bundles of type 1 collagen fibers within its matrix, making it extremely tough and capable of withstanding heavy compression, tension, and shear forces. Examples include the intervertebral discs that separate and cushion the vertebrae of the spinal column, each consisting of a central gelatinous nucleus pulposus surrounded by a tough fibrous annulus fibrosus, the pubic symphysis where the 2 pubic bones meet anteriorly and must withstand significant forces during weight-bearing, and the menisci of the knee joint, which act as shock absorbers and improve joint congruity. The next specialized connective tissue is bone, also known as osseous tissue. Bone is a hard, dense, and mineralized connective tissue that provides structural support for the entire body, protects vital organs such as the brain within the cranial vault, the heart and lungs within the thoracic cage, and the pelvic viscera within the pelvic girdle, serves as a reservoir for calcium and phosphate ions, which are essential for numerous physiological processes, and houses the bone marrow where hematopoiesis, the production of all blood cells, occurs throughout life. The extracellular matrix of bone contains type 1 collagen fibers embedded in a ground substance that is heavily impregnated with calcium salts, primarily in the form of hydroxyapatite crystals, which are composed of calcium and phosphate arranged in a crystalline lattice. This unique combination of organic components, the collagen which provides tensile strength and flexibility, and inorganic components, the hydroxyapatite which provides compressive strength and rigidity, gives bone its remarkable mechanical properties that allow it to withstand both tensile and compressive forces without failing. Unlike cartilage, bone is highly vascular and receives a rich blood supply through nutrient arteries, periosteal vessels, and metaphyseal and epiphyseal arteries, with blood flowing through a complex network of channels within the matrix. The cells involved in bone tissue include osteoblasts, which are cuboidal cells lining bone surfaces that are responsible for building new bone by synthesizing and depositing the organic components of the matrix called osteoid, and then facilitating its subsequent mineralization by concentrating calcium and phosphate ions. Osteocytes are mature bone cells that derive from osteoblasts that have become surrounded by mineralized matrix, and they reside in small spaces called lacunae, maintaining the matrix and sensing mechanical loads, and they communicate with each other and with cells on the bone surface through long cytoplasmic processes that run through tiny channels called canaliculi. Osteoclasts are large, multinucleated cells derived from the monocyte macrophage lineage that are responsible for resorbing and breaking down bone tissue during the continuous process of bone remodeling, which allows for calcium homeostasis, repair of microdamage, and adaptation to mechanical loading. There are two main structural types of bone that differ in their organization and density. Compact or cortical bone forms the dense, solid outer layer of all bones and constitutes approximately 80% of the skeletal mass. It is organized into functional units called osteons or Haversian systems, each of which consists of concentric rings of mineralized bone matrix called lamellae, surrounding a central Haversian canal that contains blood vessels, nerves, and lymphatic vessels. Between the lamellae are small spaces called lacunae that contain osteocytes, and these lacunae are connected by tiny canals called canaliculi that allow for nutrient and waste exchange and intercellular communication. Perforating canals called Volkmann canals connect adjacent Haversian canals and also connect the Haversian systems with the periosteal and endosteal surfaces. Spongy or cancellous bone forms the inner lattice-like network of bony trabeculae within the ends of long bones and the interior of flat, short, and irregular bones. This structure is lightweight yet strong, with the trabeculae oriented along lines of mechanical stress to provide maximum strength with minimum mass, and the spaces between the trabeculae are filled with red bone marrow where hematopoiesis actively occurs. Another specialized connective tissue is blood and lymph, which are both considered fluid connective tissues because they have liquid extracellular matrices. Blood is a fluid connective tissue with a liquid extracellular matrix called plasma, in which various formed elements are suspended and circulate throughout the cardiovascular system. Plasma constitutes approximately 55% of whole blood volume and contains water, electrolytes such as sodium, potassium, calcium, and chloride. Plasma proteins, including albumin, which maintains oncotic pressure and transports various substances, globulins, which include immunoglobulins for immune defense, and carrier proteins for hormones and metals, and fibrinogen, which is essential for blood coagulation. The formed elements include erythrocytes, which are red blood cells responsible for oxygen transport from the lungs to the peripheral tissues and carbon dioxide transport from the tissues back to the lungs for elimination. Erythrocytes are unique among body cells in that they lack nuclei, mitochondria, and ribosomes in their mature form, allowing maximum space for hemoglobin, the iron-containing protein that reversibly binds oxygen. Leukocytes are white blood cells involved in immune defense against infectious agents, foreign substances, and abnormal cells. And they are classified into granulocytes, including neutrophils, which phagocytose bacteria, eosinophils, which combat parasites and modulate allergic responses, and basophils, which release histamine and other mediators, and agranulocytes, including lymphocytes, which are responsible for specific immune responses through B cells, T cells, and natural killer cells, and monocytes, which differentiate into macrophages and dendritic cells and tissues. Thrombocytes are platelets, which are small, enucleate cell fragments derived from megakaryocytes in the bone marrow, and they are essential for hemostasis and blood clotting, forming platelet plugs at sites of vascular injury and releasing factors that initiate and amplify the coagulation cascade. Blood functions in transporting oxygen, nutrients, hormones, and waste products throughout the body, in mounting immune responses against pathogens, and in forming clots to prevent excessive bleeding when blood vessels are damaged. Lymph is derived from blood plasma that is filtered out of capillaries into the interstitial spaces as a result of hydrostatic and osmotic pressure gradients, and this interstitial fluid, once it enters the initial lymphatic vessels through one-way valves, is called lymph. It circulates through a network of lymphatic vessels, passing through multiple lymph nodes where it is filtered and where resident immune cells can survey it for the presence of pathogens, abnormal cells, and foreign antigens. Lymph is ultimately returned to the bloodstream via the right lymphatic duct and thoracic duct, which empty into the subclavian veins. Lymph thus serves to return fluid and proteins that have leaked out of capillaries back to the circulation, preventing the accumulation of interstitial fluid and the development of edema, and it also transports dietary lipids absorbed from the small intestine and carries immune cells throughout the body. Before we discuss clinical correlations, we must also consider embryonic connective tissue, which is called mesenchyme. Mesenchyme is the primitive, undifferentiated embryonic tissue from which all other connective tissues in the body ultimately arise during development. It consists of star-shaped or spindle-shaped mesenchymal cells embedded in a viscous, gel-like ground substance that contains fine, delicate reticular fibers and abundant hyaluronic acid. These mesenchymal cells are multipotent, meaning they have the capacity to proliferate and differentiate into various connective tissue cell types, including fibroblasts, chondroblasts, osteoblasts, and adipocytes, as well as smooth muscle cells and endothelial cells, as development proceeds and tissues are formed and organized. Mesenchyme is found primarily in the embryo, where it fills the spaces between developing organs and gives rise to the specialized connective tissues of the adult. However, small populations of mesenchymal-like cells persist in adults, particularly in association with blood vessels as parasites, and in various tissues as resident progenitor cells, where they serve as a source of regenerative cells that can proliferate, migrate to sites of injury, and differentiate when needed for tissue repair and wound healing following damage. Now, let us integrate this foundational knowledge with some important clinical correlations involving disorders of connective tissue. Ehlers-Danlos syndromes are a heterogeneous group of genetically inherited disorders caused by defects in the synthesis, structure, processing, or assembly of collagen. These defects result in a classic clinical triad of hypermobile joints that are excessively flexible and prone to subluxation and dislocation due to ligamentous laxity, hyperextensible skin that is fragile and bruises easily due to dermal fragility, and generalized tissue fragility that can lead to complications such as vascular rupture and organ rupture in the more severe forms. Marfan syndrome is an autosomal dominant genetic disorder caused by mutations in the gene encoding fibrillin-1, which is an essential glycoprotein that forms the microfibrils providing structural support for elastic fibers. This defect leads to a characteristic phenotype, including tall stature with disproportionately long limbs and digits, joint laxity, lens dislocation in the eyes, and life-threatening cardiovascular complications such as progressive dilation of the aortic root with increased risk of aortic dissection and rupture. Osteoarthritis is the most common form of arthritis and is characterized by the progressive degenerative breakdown and loss of articular hyaline cartilage. As the cartilage progressively wears away, the underlying subchondral bone becomes exposed and undergoes reactive changes including sclerosis, cyst formation, and osteophyte development, leading to joint pain, stiffness, and progressive loss of function. Risk factors include advancing age, obesity, prior joint trauma, and genetic predisposition. Osteoporosis is a systemic metabolic bone disease in which bone mineral density and bone mass are progressively lost due to an imbalance between bone resorption by osteoclasts and bone formation by osteoblasts, resulting in microarchitectural deterioration of bone tissue and increased skeletal fragility and fracture risk, particularly at the hip, vertebrae, and wrist. It is most common in postmenopausal women due to estrogen deficiency, but it also affects the elderly and individuals with various secondary causes. Scurvy is a nutritional deficiency disease caused by inadequate dietary intake of vitamin C, which is an essential cofactor for the enzymes that catalyze the hydroxylation of proline and lysine residues during collagen synthesis. Without sufficient vitamin C, collagen chains cannot be properly hydroxylated, and the resulting collagen molecules are unstable and cannot form stable triple helices or cross-link properly, leading to a classic clinical presentation including bleeding gums, poor wound healing, easy bruising, and fragile blood vessels. Fibrosis refers to the excessive pathological deposition of dense, irregular connective tissue, forming scar tissue, following tissue injury, chronic inflammation, or other forms of damage. While scar formation is initially part of the normal wound healing process, excessive or progressive fibrosis can lead to organ dysfunction and failure, as seen in conditions such as liver cirrhosis, where fibrous tissue replaces functional hepatocytes. Pulmonary fibrosis, where thickening of alveolar walls impairs gas exchange, and systemic sclerosis, where widespread fibrosis affects the skin and internal organs. In summary, connective tissues form a continuous and integrated system that extends from the rigid skeleton to the fluid blood. The properties of each connective tissue type, ranging from loose areolar tissue to dense bone, are exquisitely tailored to its specific mechanical and physiological roles in support, protection, and metabolic exchange throughout the body. Thank you for watching. Don't forget to like, share, and subscribe. See you in the next one.